Good afternoon, guys. Now I've got discussion B for you, and we're discussing if pain continues after surgery, after injury heals. Okay, so that is the title for this afternoon's B. So please join me in this afternoon's discussion B. Pain continues after the injury heals. The phrase pain continues after the injury heals. The new science of chronic pain refers to a growing understanding in medical science that chronic pain can persist even after physical injuries have fully healed. Here's a breakdown based on the surrounding page content. Okay. What the new science reveals. Traditional view. Pain is a proactive signal from the brain in response to tissue damage, e.g., sprains, fractures. Once the injury heals, pain should resolve. New understanding. Chronic pain can persist without ongoing tissue damage. This is due to nerves to a nervous system signaling problem, not structural injury. Okay. Nociplastic pain, a false alarm. Definition: nociplastic pain arises from altered nerve signals in the brain and spinal cord, not from actual tissue damage. Key characteristics: pain lasts well beyond the normal healing time. Pain spreads beyond the original injury site. Heightened sensitivity to touch, light, sound, or smell. Okay. Non-pain symptoms like fatigue, brain fog, and sleep disturbances. Diagnosing and treating chronic pain. Common conditions: chronic back pain, migraines, fibromyalgia, irritable bowel syndrome, pelvic pain. Diagnosis tools: central sensation inventory, or CSI, a free online questionnaire to screen for nervous system related symptoms. Specialist pain clinics, physical medicine, and rehabilitation doctors and psychologists trained in chronic pain. Treatment approaches: focus on calming the nervous system rather than resting the injury area. Pain programs and selected medications may help. Educational resources like the author's book Sunbreak, Healing the Pain No One Can Explain, offer guidance. Would you like to explore how this concept intersects with the frailty aware or neuroplasticity driven rehabilitation? I think it could tie beautifully into your work on aging, resilience, and memory friendly environments. Absolutely. Based on the surrounding page content, here are several examples of chronic pain conditions, particularly those associated with non-symplastic pain, where the nervous system continues to send pain signals even after the original injury has healed. Common chronic pain conditions. Condition description: chronic back pain, pain persistent long after a strain or injury, often spreading beyond the sites, migraines, recurring headaches with heightened sensitivity to light, sound, and smell, fibromyalgia, widespread body pain with fatigue, brain fog, and sleep disturbances, irritable bowel syndrome, abdominal pain, and discomfort without clear structural damage. Pelvic pain, persistent pain in the pelvic region, often without an identifiable injury. These conditions are often misunderstood because they don't always show up on imaging or labs tests. Instead, they reflect a nervous system signaling issue, not ongoing tissue damage. Would you like to explore how these conditions intersect with frailty-aware care or memory-friendly housing environments? There's a rich opportunity to integrate this understanding into more holistic and equitable care models. Chronic pain can have a profound impact on mental health, and the surrounding page content highlights several key ways this occurs. Mental health effects of chronic pain: fatigue and brain fog. Chronic pain often comes with persistent fatigue and cognitive difficulties, such as trouble concentrating or memory lapses. These symptoms can mimic or exacerbate depression and anxiety, sleep disturbances. Difficulty sleeping is common in chronic pain conditions. Poor sleep quality can worsen pain perception and increase emotional distress, creating a various cycle. Sensory overload and emotional sensitivity. People with non or no nocipic plastic pain may develop heightened sensitivity to light, sound, and touch. This sensory overload can lead to irritability, anxiety, and social withdrawal, psychological strain, and isolation. The invisible nature of chronic pain, especially when it doesn't show up on imaging, can lead to feelings of invalidation, frustration, and loneliness. This is particularly true for conditions like fibromyalgia, irritable bowel syndrome, increased risks of depression and anxiety. Chronic pain alters brain signals and stress responses, increasing vulnerability to mood disorders. The ongoing discomfort and loss of function can erode emotional resilience over time. Integrated care approaches. Psychologists trained in chronic pain can help patients reframe their experiences and develop coping strategies. Pain programs often include cognitive behavioral therapy, mindfulness, and education to calm the nervous system and improve emotional well-being. Would you like to explore how these mental health impacts could be addressed through memory-friendly housing design or therapeutic technologies in elder care? It could be a compelling extension of your work on autonomy and emotional resilience in caregiving environments. Mindfulness offers a range of benefits for individuals living with chronic pain, especially nociplastic pain, by helping regulate nervous system and improve mental health. Drawing from the surrounding page content, here's how mindfulness can make a meaningful impact. Key benefits of mindfulness for chronic pain. Benefit: how it helps. Calms the nervous system. Mindfulness reduces brain the brain's tendency to send false pain signals, helping turn off neuroplastic pain, improves emotional regulation, enhances awareness and acceptance of pain, reducing anxiety, frustration, and emotional sensitivity, reduces sensory overload, helps individuals manage heightened sensitivity to light and sound and touch by fostering grounded awareness, supports sleep and fatigue. Mindfulness practices can improve sleep quality and reduce fatigue, which are common in chronic pain. Boosts cognitive clarity. Regular mindfulness can alleviate brain fog and improve focus and memory. Empowers self-management. Encourages a proactive approach to pain, fostering resilience and self-efficacy. Integration into care. Mindfulness is often included in pain programs alongside cognitive behavioral therapy and education. These, give me 1 second, guys. Programs aim to reframe the brain's pain response and improve overall well-being. Would you like to explore how mindfulness could be embedded into smart housing environments or caregiver training programs? It could beautifully complement your work on therapeutic design and emotional resilience in elder care. Okay, guys, so that is B for you. I'll be back on with C shortly. Give me a bit for C, please, and I'll have that for you shortly.